welcome to today's session. Today we are looking at the hearing loss. Okay, this is a mechanical or a nervous impediment to the transmission of sound waves to the brain because of a decreased ability to hear sounds. It can be conductive hearing loss or sensory neural hearing loss. So conductive hearing loss is caused by mechanical problems in the ear, whereas sensory neural hearing loss is caused by distraction or impairment of the nerve endings in the ear. It could also be mixed, where someone has both conductive hearing loss and sensory hearing loss. Okay, or we could have the central one, where it includes concepts such as presbycusis. This presbycusis is the most common type of sensory neural hearing loss and is the gradual loss of hearing in both ears occurring during the aging process. Or it could be sudden sensory neural hearing loss, the SSNHL, and this occurs over 72 hours or less, and it usually affects one ear. So the hearing loss depends on the cause, and with the prompt treatment, so the sudden sensory neural hearing loss, okay, may be restored. Okay, we also have noise-induced hearing loss, and this could be probably transient or permanent in nature. Look at the pathophysiology, and the pathophysiology is saying that with conductive hearing loss, this normally sound wave transmission is interrupted between the external canal and the inner ear. This is the junction of the steps and the oval window. Whereas when you look at the sensory neural hearing loss, sound wave transmission is normally interrupted between the inner ear and the brain. So this is due to the loss of the acoustic nerve function or a damaged cochlea. So with the mixed hearing loss, there is a conduction dysfunction and a sensory neural transmission where they are combined together. But with central hearing loss, the auditory brainstem responses are distorted or could be absent. What are the causes of conductive hearing loss? In conductive hearing loss, we could have blockage of the external ear, e.g. with the foreign body. So foreign body lodged in the ear canal creates a physical barrier obstructing sound waves from reaching the eardrum. Or we could have cerumen impaction, that is earwax blockage. We know that the buildup of earwax can occlude ear canal, causing conductive hearing loss by muffling the sound transmission to the eardrum. We also have malformations of the outer ear or ear canal or the middle ear structures. So found that structural abnormalities from birth or developmental issues can impede the proper conduction of the sound waves, leading to the hearing loss. We also have cholecystomas. These are abnormal non-cancerous growth in the middle ear behind the eardrum. It can erode bones and disrupt the normal hearing mechanism. Exostosis, these are bone growths in the ear canal, often due to repeated exposure to cold water or wind, and can obstruct sound waves and cause conductive hearing loss. Otitis media, these are middle ear infection, so or otitis externa, the swimmer's ear. These infections in the middle and the outer ear can lead to inflammation and fluid accumulation and consequently blockage, disrupting sound transmission, contributing to conductive hearing loss. Otosclerosis, this is the abnormal bone growth in the middle ear that immobilizes the step bones, impeding sound conduction. Also have psoriasis. Psoriasis affecting ear canal can occur to scaling, itching, inflammation, causing hearing loss. Other factors could include serous otitis, that is fluid accumulation in the middle ear, which can dampen sound vibrations, leading to hearing loss until the fluid is drained or absorbed. We also have squamous cell carcinoma. The cancerous growth in the ear canal can block sound waves, causing hearing loss in addition to other symptoms related to the tumor. We could also have injury to the ear, the trauma. Such injuries such as severe blow to the head or punctured eardrum can damage the delicate structures of the ear, disrupting sound conduction. We also have tumors, benign or malignant. So tumors in the ear canal or middle ear can physically obstruct the passage of sound waves, leading to conductive hearing loss. And finally, factor on conductive hearing loss, we have tympanic membrane abnormalities. We could have thickening, retraction, scarring, or perforation. We know that changes in the eardrum structure can impair its ability to vibrate properly, affecting sound transmission in the middle ear. What about the causes of sensorineural hearing loss? We could have acoustic neuroma. This is a non-cancerous tumor that normally affects the auditory canal on the auditory nerve, causing hearing loss, ringing in the ears, and balance problems. Also, aging. We could have gradual deterioration of hearing due to aging, affecting the hair cells and nerves in the inner ear. Atherosclerosis is normal result in thickening and hardening of arteries, leading to reduced blood flow, which can affect the inner ear's blood supply. Autoimmune diseases, we find that in the immune system normally attacks the inner ear, causing inflammation and damage of the hair cells and auditory nerves. We also have brief exposure to extreme loud noise greater than 90 decibels. So sudden exposure to very high sounds can damage the hair cells in the cochlea, leading to irreversible hearing loss. We also have cochlear otosclerosis. This is characterized by abnormal bone growth in the inner ear, disrupting sound transmission and causing sensorineural hearing loss. Drug toxicities, whereby certain medications are found to be toxic to the inner ear and can damage hair cells, leading to hearing impairment. Drugs like aminoglycosides, chemotherapeutic agents have shown such characteristics. Head or ear trauma, injury to the head or ear can damage the auditory nerves or inner ear structures, resulting in sensory hearing loss. Impairment of the cochlea, that's the eighth cranial nerve or the acoustic nerve branch, can damage to the crucial auditory components, which leads to permanent sensory neural hearing loss. Meniere's disease, this is an inner disorder that is normally characterized by vertigo, tinnitus, hearing loss, often leads to build up of fluid and pressure changes, thus resulting into sensorineural hearing loss. Organ of Corti degeneration. So degeneration of this important part to the inner ear leads to inability to transmit sound signals. We also have otospongiosis. Here we have an abnormal bone growth in the middle ear affecting the stapes bone, leading to hearing problem. We also have the perilymphatic fistula. This is have abnormal connection between the middle and the inner ear, disrupting fluid balance and causing sensorineural hearing loss. We had already mentioned the presbycubitis. This is age-related hearing loss caused by changes in the inner ear structures, including loss of hair cells and nerve fibers. Prolonged exposure to loud noise, 85 to 90, greater than 90 decibels. We have long-term exposure to moderately loud sound can damage these hair cells, resulting in sensorineural hearing loss. For tumor, we are saying that tumors on the auditory nerves or inner ear structure can cause hearing loss depending on the tumor's location. Lastly, vascular occlusion of the anterior cerebellar artery. So reduced blood flow due to vascular blockage can damage the auditory nerves, leading to the sensory neural hearing loss. So what are the risk factors for the hearing loss? We could have a frequent ear infections. So repeated ear infections, especially in childhood, can cause damage to the delicate structures of the inner ear. So we have prolonged or untreated infection can also lead to inflammation and fluid buildup, affecting the ability to hear properly. So chronic ear infections may result in permanent hearing loss. Also, the use of headphones with loud music or listening to music at higher volumes through headphones or earbuds can expose the ears to excessive noise levels. So that we have prolonged exposure to loud sounds can damage the hair cells in the inner ear, leading to sensory neural hearing loss. This type of hearing loss is irreversible and can be prevented by keeping the volume at safe levels. As people age, also structures within the inner ear naturally degenerate. So these age changes, this age-related hearing loss is normally termed as presbycubitis. Is a common condition. It primarily affects higher frequencies and it results in a natural aging process affecting the auditory system. Lastly, exposure to chemotherapeutic agents, chemotherapy drugs, loop diuretics, high-dose aspirin, phosphodiesterase 5 inhibitors, cocaine, and other chemicals um, has been shown to damage the hair cells in the inner ear and or can also affect the auditory nerve. So this damage can lead to sensory neural hearing loss. Remember that chemotherapy drugs in particular are known for their ototoxic effect, the ear damaging effects. The incidence, find that aging is responsible for most cases of hearing loss in United States. People of any age can be affected by hearing loss. When you look at in terms of gender, males are more likely to experience hearing loss than the females. Commonest complications include the tympanic membrane perforation, cholesteatomas, and permanent hearing loss. In assessment, you need to find out if there's any cause of this hearing loss related to recent upper respiratory tract infection, exposure to chemical agents, including some chemotherapeutic drugs, exposure to ototoxic medications like even aminoglycosides, tendency to ask others to repeat. This could be a sign and classic sign that someone is having hearing loss. Tendency to increase volume on the television or phone also. Also, the patient could present with dizziness or report tinnitus. Could also complain of having trouble hearing in a noisy area following conversation of two or more people are talking or telling high-pitched sounds apart. We could also have history of recent exposure to loud noise or brief exposure to extremely loud noise, okay, above sounds above 90 decibels. We could also have persistent tinnitus or congenital disorders, okay, or we could also have genetic syndromes or hereditary susceptibility. Also, tumors and progression of the hearing loss could also be a key factor. So we could also do the Weber and Rhine test, whereby Weber test a tunic fork, a vibrating tunic fork is normally placed on the head's mastoid bone. So after placing on the mastoid bone, when he stops or they stop hearing, it is normally brought beside the meatus. Okay, so we say that Rhine test is positive when air conduction AC is longer or louder than BC, that is the bone conduction. Okay, so it is normally seen in a normal person or those who have sensory neural hearing loss. As for the Weber test, a tuning fork is normally placed on the forefront or forehead, And normally the patient should report that the sounds are centrally so that there is no lateralization. But you find that in conducive hearing loss, or in conductive hearing loss, we normally have lateralization to the deceased ear, whereas in sensory neural hearing loss, we have lateralization of sounds to the healthy ear. Okay? So in physical findings, in short, we normally have obvious hearing difficulties, otonuria, facial asymmetry, and abnormality of the external ear or tympanic membrane or visualization with an otoscope. So on obvious hearing difficulty, we could record the decibels. Okay. So indicative of the tuning fork test, we say that Weber, first of all, is normally used to test lateralization to an affected ear. So if you have lateralization to an affected ear, that is, could have sensory neural hearing loss. Lateralization of sound to affected ear, that could be conductive hearing loss. So in short, for the Rhine test, we have air conduction sound are heard longer than the bone conduction. This could be a normal finding or a finding in a person with sensory neural hearing loss. Whereas bone conduction sound heard longer or equally as long as the air conduction will be a finding for the conductive hearing loss. So I've tried to summarize here, guys, the Rhine test, Weber test. So we are saying that hearing loss, it could either be sensorineural or conductive. So when you perform the Rhine test, okay, you hit the tuning fork, okay, and you place beside the mastoid bone. You listen. When it stops, you bring it beside the meatus. In a normal finding, you still need to hear the tuning forks vibrating. So that in that case will be air conduction is greater than bone conduction, which will be a normal finding in a normal ear, or if somebody has a sensory neural hearing loss, will also present with the same. Okay? For the conductive hearing loss, you strike the tuning fork and you place it on the forehead. You need to hear the sounds equally or at the center, okay, at the center of the head. So categories of hearing loss can be categorized based on the number of decibels lost. Okay, the categories range from slight to profound, and this is what we really need to get it. Okay, so greater than 90 decibels, this is beyond normal. Okay, correct. In terms of diagnostic tests, we are saying that in laboratory, laboratory will have white cell count and differential may be elevated with an infection. For imaging, we normally do the MRIs, which normally show acoustic tumors and brain lesions. CT scan normally shows abnormality in vesicular and auditory pathways. Note that patients with suspected sudden sensorineural hearing loss should have a contrast MRI wherever possible, rather than the CT scan. So a CT scan doesn't provide sufficient resolution for detecting tumors of the cerebellopontine angle or small brainstem infarctions. If a patient can't undergo an MRI, then CT scan will be used. We also have auditory brainstem evoked response and autoacoustic emission test results may also help evaluate cochlear and auditory nerve function. We could also have pure tone audiometry. This one may show the presence and the degree of hearing loss, or tympanometry reveals fluid or retraction. We also have electrons stigmography. It may show vestibular function involved with hearing loss, or otoscopy. This one may show middle ear disorder, deformity, obstruction, mass, or impaired integrity. Others we have hearing evaluation. This one that may confirm the diagnosis. In terms of treatment, we have general treatment, where general treatment varies with the type and cause of impairment. Hearing aids or other effective means of aiding communication We could also have diet where there is no significant restriction, or activity, we need avoidance of activities that will allow water to enter into the ear, especially if the eardrum is perforated. So in terms of medication, you need to give antibiotics to treat infections, agent to dissolve the cerumen. We can also give the decongestants, analgesics such as acetaminophen and ibuprofen for pain relief, antipyretic for fever with infection. Also use high-dose oral corticosteroids such as prednisolone or dexamethasone for spontaneous sensorineural hearing loss. We can also give hyperbaric oxygen therapy for idiopathic spontaneous sensorineural hearing loss, especially in combination with corticosteroids. In surgery, we can perform the mastectomy, oscillochain reconstruction, spindectomy, and cochlear implant for profound bilateral sensory hearing loss. The nursing interventions, you need to face the patient when speaking and speak clearly and slowly. You need to allow time for the patient to process information and to respond. You need to validate the patient understands the information. Administer prescribed medication such as analgesics or antibiotics. Provide ear care such as ordered. Remember to assist with the removal of cerumen if indicated. You need to provide alternative method of communication such as a pen or paper gestures, lip reading, a telecommunication device for the deaf patients, or video remote interpreting devices. We can also assist the patients with using a hearing aid and also encourage the patient to participate in care and decision making as appropriate to promote feelings of control and to enhance self-esteem. Prepare the patients and family for possible surgery and then provide support to help the patient resist the urge to withdraw from social situation. So guys, that is the presentation on hearing loss. Remember guys to check in the description section for a link to the quiz just to test your knowledge and reinforce your understanding. Thank you so much.